COVID-19 has had a dramatic effect on cardiovascular care throughout the world. Number one, important to remember that patients who have a history of cardiovascular disease have increased risk of mortality. So it's important for us when you take care of these patients to let them know that. Number two, when you look at hospitalized patients, about 15 to 30% of patients will have an elevated troponin. And we'll come back to that. But the point is, we know that patients who have an elevated troponin on admission are at higher risk for mortality. And then number three, we know that it's COVID has dramatically affected the business of cardiology, of us taking care of patients. So, all across the world, there's been a 28 to 45% reduction initially in STEMI patients coming to hospital, but in all cardiovascular care. So this was a combination of SCAI, which is a Society of Coronary Angiography and Intervention, the Canadian Angiography Intervention Society, so really the two large societies in Canada and the United States, and the American College of Cardiology Interventional Council. So really everybody working together to create a registry. And really within 2 weeks, we had a protocol, we had a consent form, we had a central IRB, and we had it up and running. Number one, there's a predilection for Black and Hispanic patients. So compared to COVID positive to suspected, it was 27% versus 11 in terms of Black and 24% versus 6 in terms of Hispanic. Only 33% of the patients who are COVID positive were Caucasian, which is remarkably lower than any other registry for ST elevation. And then the other group is diabetics. So 44% of the COVID positive people with ST elevation had diabetes. And in the suspected group, it was 33%. And in the cohort, the matched cohort, was only 20%. So diabetics, Blacks, and Hispanics have a unusual predilection. Number two, when patients come to the hospital, what they did is they're more likely to come with cardiogenic shock and they had lower ejection fraction, but no increase in cardiac arrest. So I think that's a very interesting finding. They're also more likely to have unusual symptoms like dyspnea or to present with an abnormal chest x-ray. And they were more likely to get in-hospital STEMI, so to develop the ST elevation in the hospital. Not as high as some of the previous reports, but definitely an increase. And I think what's unique about this registry is we took all ST elevation, and you see 20% don't even go to the cath lab. And we're going to learn more about that patient group. If you go to the cath lab, 71% got a PCI, a very small percentage of people got lytics, but about 20% were treated medically, which is higher than normal. And then I think the final point, and the most important point, it's been reported that they had increased mortality, but there's been a wide range. And what we found is the COVID positive patients had an in-hospital mortality of 32%. The COVID suspected patients had a mortality of 12%. And then compared to the matched controls, it was 6%. I think importantly, going forward, we have a lot to learn. And I think we now have almost 200, actually, even since we did the presentation, we have more patients, almost 200 COVID positive patients. Our goal is to get to 500. And what we want to do is we want to look at some unique groups. What about the patients who didn't go to the cath lab? Why? Who were those patients? Were they too sick? What were the reasons? And then we want to look at the patients who didn't get PCI and why.